I had my oldest son's babysitter had their son circumcised when he was 5. So I have no idea exactly why. One of the students in the morning told me that in the Philippines it's more common to have the boys are not circumcised until they're 10 or 11, rather than as infants. My husband is circumcised, and we had both of our boys circumcised. As an RN, when I was working in the hospital in the 80s, is when I worked labor, delivery, and postpartum most of the time. And it would be the OBGYNs that would circumcise the infants, usually on the 2nd day, and they'd go home at the end of the 3rd day. And we had these long boards, about 28 inches long, with depression in the shape of the infant, called circuit boards. And they'd have Velcro straps. And so we'd place the baby, this diaper loosened, on his back, and Velcro strap him down, and they'd start screaming. And they'd cry so hard, but by the time the doctor got there, they were usually asleep. And he would pull up the infant's penis and called it a Gomco clamp. It had a couple of parts, and there would be a ring that he would put around the shaft of the penis here, pull the foreskin down, and then put another ring that fit over that, screw it down tight, and then just one kind of sweep of the scalpel would cut it, and you'd have a donut of skin. And that would the tighten of the ring would keep it from bleeding when he cut it. And then when he undid that, there would be some oozing, and we would wrap a Vaseline strip, a piece of gauze with Vaseline and powdered coagulant on that, and then just change it each time the diaper was changed. And within 3 to 5 hours afterwards, it wasn't even oozing blood. So when our oldest son was born, it was a 24-hour stay. And the pediatrician came by and said, "Do you want your son circumcised?" And we said yes. So he said, "Bring him by the office in a week." And the appointment was exactly 7 days. Now his first and last name were both biblical, well, not biblical. First name was Matthew, the last name was a Jewish name. And I knew that Jewish tradition was to circumcise the infants on the 7th day. And I learned something new this morning. I always had interpreted that's about the time it takes for the normal flora of the large intestine to develop, and they synthesize vitamin K, which is what our body absorbs in a symbiotic relationship for blood clotting. And that's when it reaches normal levels. But one of my morning students said, well, actually, she said the reason why is the prepuce, the foreskin, doesn't separate readily from the base of the gland penis until that time. If you try to pull it down, it can cause adhesions and tearing and leave some scarring there. So with our oldest son, we showed up, went into the doctor's office, and they put him on the circuit board, and they placed a local injection right here at the base of the shaft. And then he really started hollering. And I'd never seen that before. And I said, "What's that?" And he said, "It's a local anesthetic. It's been determined that the babies do feel some pain. And if you've ever had a local, that hurts too." So I don't know which was worse. But he screeched throughout the entire procedure. And I've helped out with hundreds of circies, and I thought I was fine. And I sat there and held onto his big toe. And it wasn't very big at the time. And my husband sat facing me. And I did not realize how upset I was going to be. I knew if I looked at my husband, I was going to burst into tears. I just sat there and held on to that big toe. Our second son came along. We still wanted him circumcised. I just handed it to the nurse and said, "Bring him back when he's done. I don't want to be there." So like I said, it's a cultural or family decision. I think in San Francisco they tried to outlaw male circumcision, and that didn't go over very well. It's in the last 4 or 5 years. Some males are never circumcised, and if they are, there's some. It might interfere with sensory. Obviously, my son's not going to know whether it interferes with his, experience in intercourse or not, because he hadn't had intercourse at 7 days old, obviously. There was a journal paper came out about mid-90s saying that there was no reason to circumcise. Children can be taught to clean in this area here thoroughly by just pulling the prepuce down, and you were born with that, it obviously had a function, and you should leave it there. About 2 months, 3 months later, in the Journal of Obstetrics and Gynecology, an article came out that said, well, while there might not be any advantage to the male, in the female, there were decreased incidences of cervical cancer if the women, or increased if they did, had intercourse with men who had been circumcised versus not circumcised. So having intercourse with a circumcised male was healthier for the female. Again, it's an issue of cleanliness. I'm sure if there was, less, not just irritation, but if there was focus on the cleanliness, if you wouldn't see any issues with the women's health versus a circumcised or an uncircumcised male. So it's, again, yes.
So they say that if you get circumcised, you get less chances of getting transmitting to HIV.
HIV, really?
Yeah.
Because there's pockets that aren't held up in here. This was the mid-90s, so I don't know if that was one of the things they looked at in the health for the male.
But other than that, is there any advantage if you get circumcised or not?
Well, not according to this article.
Okay.
So, again, it's, if you teach the male child the proper procedures. Again, one of the students in this morning told, she did not have her boys circumcised, but she has young children and older children. And she told me, she said, my daughter came to me and was having sexual relations with the man who wasn't circumcised and said, Mom, it's just really stinky down there. So again, just a matter of cleanliness, I'm assuming, and frequent cleaning of the area, because it does form a, like you clean on your fingernails kind of a thing. So, optional. On Tuesday, we'll talk about female circumcision, which is a completely different, should be called something else. Because while women have a prepuce, female circumcision is removal of the erectile tissue. Right? So they can't have an orgasm. The glans clitoris and crus and all of that is removed. So it's completely, wholly different. All right, let's just look at a cross-section again of the penis and look at. So here, I call it a monkey face. Every time I see my husband's penis, I don't think monkey face. I only think it when I see a cross-section. So these two larger structures, don't put that up on YouTube.
No, I just ended the tape, so I missed that whole.
These two larger structures here are corpus cavernosa. Again, the corpus spongiosum is going to have the urethra. I've been doing this so long, I'm not even getting red. Now, if you look at blood vessels, what's the epithelial lining of the blood vessel going to be? Simple squamous, good. All right, and the urethra? Transitional. So you're going to have multiple layers of cells, so you can tell the difference between them when you look at them microscopically. Here's the dorsal surface. So along the dorsal surface, we have dorsal vein, dorsal arteries, dorsal nerve of the penis. So that dorsal nerve of the penis is really a branch of the pudendal nerve. Okay? The yellow? The yellow. Yeah. All right, let's stop there and take a break.